The Role and Responsibilities of Community and Public Health by Jennifer Kingsley for HCA 415, Community and Public Health, with Professor Christine McMahon on March 23, 2014. Public health is active in everything people do throughout the day. Consider the overseas traveler receiving a vaccination, the child taking a sip from a public water fountain, the baby at a clinic for a well child examination, the diner in a restaurant expecting the food to be clean and safe to consume, or the camper taking precautions to avoid Lyme disease. Each of these people has been affected by public and community health. Public health is charged with protecting the health of entire populations rather than individuals by preventing the spread of disease, by alerting people to hazards at home, work, and the environment, by promoting healthy lifestyles through good nutrition and adequate exercise, and by planning, preparing, and responding to natural disasters, biochemical threats, and other emergencies. Community health is charged with studying the health of a specific geographical area and working towards improving the health of those that reside within the specific geographical area. The importance of public health and community health agencies is most evident during times of crisis, but without public and community health, many of the protections people take for granted would cease to exist. The role of community and public health in the well-being of populations. The public health system is concerned with protecting and improving the overall health of the community served by educating the people, encouraging healthy lifestyles, promoting prevention, and researching disease processes. Through these actions, public health looks to improve the health and well-being of people within the community. Community health is a component of the public health system that concentrates primarily on assessment, evaluation, and implementation of services that will improve the health of a selected population. Professionals working in community health monitor the health status of people residing in specific geographical zones. The public health organizational structure. The United States Department of Health and Human Services is the nation's primary agency charged with protecting the health of the people of the United States of America and providing essential human services to the most vulnerable in society. The United States Department of Health and Human Services is led by the Secretary. The Secretary manages 11 operating divisions, 10 regional offices, and the Office of the Secretary. The federal level of the public health organizational structure is large and complex, as evidenced by this organizational chart. The state, county, and city public health services within each region carry out the core public health functions of assessment, policy development, and assurance. In the state of Ohio, the public health organizational structure consists of the Department of Health, the Director of Health, health districts, local health boards, the health commissioner, and health advisory boards. The legal and ethical dimensions of public and community health services. The primary ethical dilemma of public and community health is to respect one's personal freedom and still afford a certain degree of health protection. Although public health challenges have varied over time, the central ethical concern in public health has remained the conflict between individual and group interests in controlling disease and promoting health. In public health, officials have the legal authority to force individuals and groups to submit and comply with any order if it is in the best interests of the society. Ethical considerations are in constant play in the public health field, but most prevalent in genetics, access to personal health information, and lifestyle choices. The latter, lifestyle choices, comes into play when the government attempts to impose laws directed at perceived poor choices, such as smoking and seatbelt usage. Many states have enacted smoking prohibition laws that have forbade smoking indoors and at outdoor sporting and concert events. This type of legislation is met with resistance due to the belief that it infringes on personal rights. The funding of public and community health services. The Prevention and Public Health Fund created by the Affordable Care Act is the first mandatory funding source set aside specifically for the betterment of the health of the people of the United States. The funding must be used for prevention and public health programs exclusively. One way in which the fund is used to support the work of the CDC and Health Resources and Services Administration in the following ways: community prevention, clinical prevention, public health infrastructure and training, and research and tracking. Even with the ACA and the 2-year budget deal signed by the President in December of 2013, public health agencies such as the CDC and Planned Parenthood are still dealing with budgetary cuts and the continued effects of the sequester. Public and community health agencies are largely dependent on governmental funding from state, federal, and local taxations. The role of communication in community and public health programs. Public health communication is the scientific development, strategic dissemination, and critical evaluation of relevant, accurate, accessible, and understandable health information communicated to and from intended audiences to advance the health of the public. Social media plays a vital role in public and community health communication, as it is readily accessible to the masses via computers, tablets, and cell phones. Social media is designed to be engaging, but often are used as a mechanism by public health organizations and practitioners for mass information dissemination rather than engaging audiences in true multi-way conversations and interactions. In order to prevent the former, it is imperative public and community health officials engage the intended audience rather than simply broadcast a message. Social media strategists suggest listening to what people are talking about on social media to better understand what information is needed. By engaging in social media influencers to facilitate conversations and responding to questions and comments on social media outlets. Through social media, public health has never been more accessible to the masses. In conclusion, the role of public and community health is immeasurable in society that values the health of its citizens. Without the services provided by public and community health agencies, the people of the United States would immediately feel the aftershocks. Food would no longer be guaranteed to be safe to eat. Water would not necessarily be clean enough to drink. Children in need of vaccinations may not have access to clinics, and children in need of supplemental nourishment may have to go without. It is for these and many reasons that continued support of laws funding public and community health programs continues to receive backing and support. Thank you.